Atherosclerosis. Atherosclerosis is a narrowing of the arteries caused by a buildup of plaque. Arteries are the blood vessels that carry oxygen and nutrients from your heart to the rest of your body. As you get older, fats, cholesterol, and calcium can collect in your arteries and form plaque. The buildup of plaque makes it difficult for blood to flow through your arteries. This buildup may occur in any artery in your body, including around your heart, legs, brain, and kidneys. It can result in a shortage of blood and oxygen in various tissues of your body. Pieces of plaque can also break off, causing a blood clot. Without treatment, atherosclerosis can lead to heart attack, stroke, or heart failure, among other conditions. Atherosclerosis is a fairly common problem associated with aging. This condition can be prevented and many successful treatment options exist. What are the symptoms of atherosclerosis? Most symptoms of atherosclerosis don't show up until a blockage occurs. Common symptoms include 1. Chest pain or angina. 2. Pain in your leg, arm, and anywhere else that has a blocked artery. 3. Cramping in the buttocks while walking. 4. Shortness of breath. 5. Fatigue. 6. Confusion, which occurs if the blockage affects circulation to your brain. 7. Loss of motor or sensory function on one side of the body, which occurs if the blockage affects circulation to your brain. 8. Muscle weakness in your legs from lack of circulation. Causes of atherosclerosis. Atherosclerosis happens when fatty deposits build up in the arteries, which causes them to narrow. Things that increase your chances of getting atherosclerosis include 1. Being over 65 years of age. 2. Smoking. 3. Having high cholesterol. 4. Having high blood pressure. 5. Having close relatives who have cardiovascular disease. How is atherosclerosis diagnosed? Your doctor will perform a physical exam if you have symptoms of atherosclerosis. They'll check for 1. A weakened pulse. 2. An aneurysm, or an abnormal bulging or widening of an artery due to weakness of the arterial wall. 3. Slow wound healing, which indicates a restricted blood flow. 4. A bruit, or whooshing sound the blood makes as it travels through the blocked artery. Treatments for atherosclerosis. There are currently no treatments to reverse atherosclerosis, but you may be offered medicines to lower your risk of having a heart attack or a stroke. You may need medicines to 1. Lower your cholesterol, statins. 2. Lower your blood pressure. 3. Lower your risk of blood clots. 4. Lower your blood sugar levels if you have diabetes. Medications. Medications can help prevent atherosclerosis from worsening. Medications for treating atherosclerosis include 1. Cholesterol-lowering drugs, including statins. 2. Angiotensin-converting enzyme, ACE, inhibitors, which may lower blood pressure. 3. Beta blockers, which rest the heart. 4. Antiplatelet drugs such as aspirin to prevent blood from clotting and clogging your arteries. Aspirin can be particularly effective for people with a history of atherosclerotic cardiovascular disease, including heart attack and stroke. An aspirin regimen discussed with your doctor may potentially lower your risk of having another health event if you already have atherosclerosis. Surgery. If symptoms are especially severe or if muscle or skin tissue are endangered, surgery may be necessary. Possible surgeries for treating atherosclerosis include 1. Bypass surgery, which involves using a vessel from somewhere else in your body or a synthetic tube to divert blood around your blocked or narrowed artery. 2. Thrombolytic therapy, which involves dissolving a blood clot by injecting a drug into your affected artery. 3. Angioplasty and percutaneous coronary intervention, which involves using a catheter and a balloon to expand your artery, sometimes inserting a stent to keep the artery open. 4. Atherectomy, which involves removing plaque from your arteries by using a catheter with a sharp blade at one end. 5. Endarterectomy, which involves surgically removing fatty deposits from your artery. Comment below if you know something extra, because it will be very beneficial for us. At the end it is requested to please subscribe our channel. Complications of atherosclerosis. Without lifestyle changes and medical treatment, atherosclerosis may get worse over time. It can cause 1. Heart attacks, 2. Stroke, 3. Peripheral arterial disease, 4. Other types of cardiovascular disease.